indicate their translation.
Lava ba tolokaka
Ke kopa hore ba tolokang ba bontshe hore ba tolokela kae.
ba bonisa leswaku va tolika hi ririmi muni.
Thank you. I think all of us have switched to simultaneous translation.
Ke leboha
whoever
hore
needs it.
bohle ba kgona ho utlwa le botoloki.
Lava kotaka ku yingisela vutoloki byo hambanana.
Sorry, Tobela, tech team. I think we are getting all the simultaneous translation at the same time, even if we've selected the English option. Before we proceed, could you please check on this?
Doing that, thanks for that.
Apologies, colleagues, as we sort this matter out.
Can you try and go ahead now, Levi?
Thank you very much, Tobela. I think we are in the clear. Thank you, colleagues, for your indulgence.
No.
Sorry, Tobela, we have Zulu translation now coming in. Please check on that. In the meanwhile, please continue to introduce yourselves in the chat box. We'd like to know where you're from, which organization you're joining from, where in South Africa you're joining from, or even where in the region you're joining from, and what are some of your expectations from today's session. We will definitely be interacting through all social media platforms. The hashtag will be Generation Equality Forum. And we will definitely be looking out at the tweets, the Facebook comments, as well as the various Instagram and TikTok posts.
Na the Facebook, la hi kotaka ku vulavurisana kona.
Levi, we'll just ask the interpreters to just hold off while you continue, and we'll sort this out at the back end. Thank you.
Thank you very much, Tobela. Very useful. Thank you very much once again, colleagues, for your indulgence and for the understanding whilst we try to navigate with the integration of the translation on the back end. Thank you all once again for joining also promptly. It's great to see so many familiar faces within the attendees list, as well as new faces. And today promises to be a frank, thought-provoking, future-facing and solutions-driven discussion, which will aim to offer thought leadership from young professionals, activists, advocates, and leaders on how we promote the meaningful and ethical engagement of young people and adolescents in the delivery of SRHR policy and programming. Our esteemed panelists will showcase the best practices and strategies they've applied to increase youth access to comprehensive SRHR services, including counseling, information, knowledge, education, as well as highlighting the gaps, the challenges, and the lessons they've learned in doing so over the COVID-19 period. Most importantly, this discussion is purposed to give voice and visibility to new thinking, new ideas, new approaches, and innovations for us to consider as we seek to build back better with and for young people now and post-COVID, and move from the new normals to the new necessaries of young people moving from just being the beneficiaries of SRHR policy and programming to the partners and leaders of it. This discussion also comes at a very timely moment. I think many of us last week were following the parliamentary proceedings whereby we heard that 1 in 3 pregnant learners do not return to school. We've probably seen the recent headlines around the rapid spike in adolescent pregnancies across all 9 provinces. We've learned from the parliamentary briefing as well that 30% of adolescent girls who are impregnated by men, of that 30%, 65 of those pregnancies are unplanned, as well as what we've known historically for over the last 5 to 7 years, around 1,300 new HIV infections occurring amongst the same age cohort every week in South Africa, as well as over 46% of sexual assaults, rapes, and violations occurring against children and adolescents ages 10 and above. So this dialogue comes at a very timely time as we discuss the Generation Equality Forum, as well as the broader move and commitment towards bodily autonomy, integrity, and sexual reproductive health and rights of adolescents and young people. I would like to hand over to Ms. Anne Gituku Shongwe, who is the first speaker for today and who will really set the tone in terms of what Generation Equality Forum is about and the importance of our action coalition. Ms. Anne is the representative for the UN Women South African Multi-Country Office, which is also responsible for women's empowerment and gender equality in Botswana, Lesotho, Eswatini, Namibia, as well as South Africa. And she's going to give us a short presentation and some remarks on the Generation Equality Forum, where we've come from and where we're envisioning to go between now and the year 2026. Ms. Anne, over to you, please.
Thank you so much, Levi, and congratulations to the Action Coalition on Bodily Autonomy and Sexual and Reproductive Health and Rights for having pulled this very, very exciting session on. I'd like to, translation has started again. Shall I go on?
Tobela, could you please advise?
So, and I'm just asking all the translators to please hold. We will notify them when they can commence again.
Okay, thank you. I want to recognize my brother Zain Dagwo from DERCO. I think I saw him briefly here, and I just want to make sure that I recognize him, as well as the entire team who are leading the Action Coalition on Sexual and Reproductive Health and Rights and Bodily Autonomy, Noel from the French Embassy, Levi, Larry, the entire team, Koketso, and all of the teams that have been part of ensuring that they can, that they mobilize this. So congratulations to you. Let me just start off by saying that for Africa, this by far of the 6 areas of the Action Coalition, this is the one issue that has tended to be the most controversial, the one that has raised the most error from people when we talk about gender equality, and the most misunderstood of the issues that are on the table in terms of gender equality. Both the International Conference on Population and Development and the Beijing Conference, Fourth World Conference on Women, which we called Beijing Conference of 1995. The two were landmark moments for this issue of sexual and reproductive health and rights. And at a time when, in fact, the issue of women's rights, women's sexual rights, and women's reproductive rights were not even an acceptable part of the debate in many of our countries. And so this comes at a time now, and this Generation Equality Forum and Generation Equality campaign really is that moment where, after reflection on both the Beijing conference, but also looking at the ICPD, we have been able to identify where we have made progress and where we are still lagging. The greatest progress has been in terms of women's girls in school, has been more and more non-discriminatory laws or less discriminatory laws still in our countries. A country like South Africa, I think we're about 88% of laws that are non-discriminatory. There's still a couple of them, especially when it comes to cultural, customary laws that are sometimes overlapping. But also the issue of maternal mortality, And yet this, even though we have seen a decrease in maternal mortality across the world, what we have seen is a direct impact on young women and girls, where we have seen an inordinate number of young women and girls, adolescent girls in particular, girls who are barely in puberty, who are trapped in what are called early marriages. We know that this is a sanitized way of describing what in other words is often actually a form of pedophilia, because these are older men who are in relationships with children, and it is real abuse of these children. And so this has been a big area of work that we at the United Nations and in partnership with you in the country have been at the forefront of ensuring the end of. But I think what is important is that as we've looked at the areas that are left undone, where there's still work to do, the 6 areas emerged from the Generation Equality Forum as work that is unfinished. And I'll just go through the 6 and then I'll focus on this SRHR. The 6 areas where work is incomplete is really around gender-based violence and femicide, and I think we all know the conversation in the country. On economic justice and rights, on feminist action for climate justice, technology and innovation for gender equality, feminist movements and leadership, and then this area of bodily autonomy and sexual and reproductive rights, health and rights. One other one is on women, peace and security, which in countries who have humanitarian crises is very, very, very important, but also in many of our countries where there is human insecurity, this is a 7th area of work. So this particular action coalition has really focused its attention on this issue of sexual and reproductive health and rights. And it is an area where, when we look at what the vision of success is by the Generation Equality Forum, I want to read it for you so that you can hear what the projection is, and it helps in the definition. Because I find that in the definition of this area, this is one of the areas where there is really lack of clarity about what it is. And if there's one thing, Levi, that we can do with this session, is to make sure that we all are on the same page about what the issues really are here. So let me start by defining it, and then I'll share the vision of success for generation equality in terms of this area. The definition of bodily autonomy and sexual and reproductive health and rights is that girls, adolescents, women, transgender and gender non-binary people can freely access comprehensive sexual and reproductive health and rights information, education, services, and commodities, and are supported by their peers, families, and societies to take decisions about their bodies, about their sexuality, about their reproduction, free from coercion, from violence, and from discrimination. I think it's so important that we're all clear that what this is about. The second point that I want to raise here really is to describe for us what the vision is of success for this area. So by 2026, the goal is that all people, particularly girls, adolescents, women, transgender and gender non-binary people in all their diversity are empowered to exercise their sexual and reproductive health and rights and make autonomous decisions about their bodies, free from coercion, from violence, from discrimination. SRHR information, education, and services are freely available, accessible, acceptable, and of high quality. Girls, women's, and feminist organizations and funds, including, among others, girl-led and youth-led, disability-led, indigenous, LGBTQ+, human rights defenders, and their allies are strengthened to advance SRHR. More governments promote, protect, and invest in SRHR, including as part of universal health coverage, working across action coalitions with multiple stakeholders, and at all levels, we transform gender and social norms, we promote gender equality, applying an intersectional, intercultural, human rights-based approach and improve SRHR outcomes, leaving no one behind. Levi, I thought it was important to start by defining this, to start by really being very, very specific about this, because this is an area that very often people will say, I'm not quite sure what this is that you're talking about. And then actually, it is likened and assumed to be about abortion rights and about rights which really are not the focus of this, or are just, one aspect of what is a rather large area and body of work that has become crucial for us as we seek full gender equality for every woman and girl in all their diversity. So in the work of generation equality, and there were platforms that were held in Mexico, in Paris, and the outcome of that is this global acceleration plan that is really trying to recognize what it would take to accelerate the world's alignment around this vision and the world's alignment around what the actions would be to ensure that bodily and autonomy and SRHR matter. We know that across Africa, the kind of data that we have is really difficult when it comes to the issue of sexual and reproductive health and rights and bodily autonomy. Early child marriage is a major issue for us. Female genital mutilation is a big issue in many of our countries. Other forms of harmful practices, both in South Africa and in this sub-region as well as across Africa, are major issues. Large numbers of adolescent girls who are likely to give birth before the age of 18 and many more before the ages of even 14. And these are resulting in real devastation in our communities. And I think the numbers that you raised, Levi, about teenage pregnancy is not unique to South Africa. It is an issue that has been exacerbated by COVID. And this is something that is really focused so much, even in our language, we're focusing on the teenage pregnancy rather than the impregnator, And so I hope that in the discussions, we're going to be able to have conversations about how to even flip some of this language so that we're really beginning to ask the questions about the perpetrators of the pregnancy rather than the carriers of the pregnancy. So that we can really put the decisions and the rights and consequences where they need to be. So I'll just conclude by talking about the 4 action areas that were identified by the Generation Equality Forum in terms of SRHR, and for which we're going to focus in the next 5 years to ensure that we're accelerating our response to SRHR. The first action is to expand comprehensive sexuality education. And this is about making sure that in and out of school, we're reaching, as many millions of children, adolescents, and youth to understand these issues of sexual and reproductive health and rights. It is not about teaching children about how to have sex. Neither is it about teaching children about how to be gay or about teaching children about, how to have abortions. This is a complete misunderstanding. Rather, this is about broadening and helping young people be empowered to understand what their lives are about, what their sexuality, their reproductive rights, what their rights are in terms of their bodies. And so this is really, really important, and it's growing in steam, and this is a crucial action. Action 2 is about increasing the availability, accessibility, acceptability, and quality of contraception and comprehensive abortion services. Over 70% of African girls and adolescents who would like to avoid an unplanned pregnancy end up in pregnancies because of their lack of access to the right contraception. So this is another big area. The third one is about increasing their sexual and reproductive health and rights decision-making and bodily autonomy. And this requires a huge investment in changing the norms, increasing knowledge of their rights, empowering all people, particularly young women and girls and adolescents, in all their diversity, to make autonomous decisions about their bodies, about their sexuality, and about their reproduction. And this requires a huge investment in the kind of policy change that will enable and ensure that there's no discrimination and there's protection around this. And our target is to make sure that we're moving across at least 20 countries in these next 5 years, if not more. And then the last one is about strengthening the girls, women's, and feminist organizations and their networks to promote and defend their rights, adolescent girls and young women's rights, and to be able to defend bodily autonomy as well. So increasing accountability, participation of and support for autonomous organizations, including women human rights defenders and peace builders, strengthening their organizations, networks, and movements to promote bodily autonomy and SRHR. You know, as I conclude, I just want to say that every year we have the Commission on the Status of Women, and Zain knows this well. We've been there together many times in very difficult negotiations. And one of the big things that emerges there is that we have been unable to move in the past, I would say, you know, even since the SDGs. So this would be 2015. And even before that, Zain, and Zain, you'll correct me if I'm wrong, is that we have been unable to move and incorporate the language of rights in many of the agreed conclusions that we struggle with, because across the world, there is lack of agreement. And in Africa itself, there's lack of agreement about sexual and reproductive health and rights. South Africa has been one of the leaders in our region because of the constitutional rights that South Africa has in relation to SRHR. But this is very contentious, and in many countries, this is not accepted. So the term rights is very often struck off and written off many of our global platforms and conventions and resolutions that are reached because of lack of consensus across the world. So as you deliberate upon this today, please know that this is, it is a very, very important area of work. It is one that is not without challenges, and it is one that you will require to be able to work really hard to look at how to embrace and bring in everyone. So you have to be tactical, you have to be strategic, we have to be very smart, Levi, about how we mobilize one another and hold hands so that we can break the barriers that have been so long in blocking the ability of adolescent girls and young women to actually live to their full potential with their full bodily autonomy and their sexual and reproductive health and rights. Thank you for the opportunity, and really, really congratulations to the team for having this exciting conversation. Thank you.
Thank you very much, Anne, for that incredibly useful scene setting and for providing that very robust overview of where we come from when we talk about the Generation Equality Forum, tracing it all the way back to the genesis of the SDGs in 2015, as well as most recently the Nairobi Summit and some of the commitments that were made there, but really narrowing it down to those 6 areas of unfinished business, and especially focusing on those 4 core SRHR focus areas that are relevant to our action coalition on SRHR. I think you've really helped us in terms of defining a shared definition and understanding of what Generation Equality Forum means, as well as what the work of the action coalitions will look like over the next 5 years. And whilst you spoke about the next 5 years, I actually tried to tabulate that in months. And as of the 14th of September, we have 62 months left between now and 2026. And I know that, that you are very soon coming to the end of your mandate within your office. And I just wanted to express our profound thanks and gratitude for your leadership, your commitment, your solidarity, your strength and your support, especially of youth-led and youth-serving organizations and feminist organizations more broadly during your tenure. We really do look forward to working with you and intersecting over the next 62 months, wherever you find yourself. But we are deeply appreciative of your contributions, Anne. And thank you once again for those incredibly useful remarks. I'd like to move on now to the next setting the scene speaker. So we tried to do something really different with this panel, not to just have a sterile, boring panel, but rather something that's really dynamic and thought-provoking. So we have Dr. Tlaleng Mofokeng, who is a superstar in the Srhr and gender equality space, as well as the award-winning author of Dr. T's Guide to Sexual Pleasure, as well as the UN Special Rapporteur on the right to physical and mental health, joining us today. And she's going to deliver a keynote address on the centrality of sexual, reproductive, and health rights for the health of young people in South Africa and the continent. Many of you may know that Africa currently has the largest population of young people in human history. So we're all looking forward to Dr. T's presentation. Dr. T, please unmute yourself and can we please have Dr. T on the big screen as she delivers her keynote for today. And congratulations, Dr. T, on the submission of your thematic report on COVID-19 and Srhr. It was an incredibly thought-provoking read, and we're looking forward to the actions that member states will take to implement some of those recommendations. The floor is yours.
Thank you so much, Levi, and thank you to all of the fellow panelists and invited guests, and to many people on this call who are fellow colleagues and friends in this important work that we've all committed our lives work to in terms of sexual and reproductive health and rights. And again, just, you know, as Levi, you were just indicating about the report to the General Assembly. In fact, in my first thematic report to the Human Rights Council presented at the 47th session, I spoke about the right to sexual and reproductive health as an integral part of the right to health. And I think it's always important that we start any conversation at the beginning, and when we seek to analyze or understand the world we live in. And of course, the problems we wish to solve, especially as young people, did not appear yesterday. And in order to then understand where we're going, we must often look back on how we got here. Controlling of sexuality, of expression, of desire, and in particular of women's and feminine presenting people's sexuality has its origins in patriarchy. And its patriarchal oppression is not specific to any country or region, it is universal. It has permeated all societies across the globe, and its impact has been devastating. Colonialism, on the other hand, was a further system that was initiated and designed as a form of hierarchy that perpetuated this patriarchal control and oppression of societies, and of course the control of sexuality and reproduction. And for many people, the bodies of women, girls, and gender diverse people have long been subjected to discrimination, to violence, to oppression, where human rights violations have occurred unabated. And many of these violations and discrimination and oppression happens between the individual and their right to health. And many of these obstacles are interrelated, they are entrenched, and they operate at the clinical level. So when young people try to access services, these obstacles are at the level of health systems, where you would find health policy decisions, where decisions are made, decisions about health funding and financing, and of course in the context of the underlying determinants of health. And the key principles that shape human rights, especially non-discrimination, equality, and privacy, as well as integrity, autonomy, dignity, and well-being of individuals, especially in relation to sexual and reproductive health rights, are again an integral element to the realization of the right to health. And we can see why this virtual dialogue is so timely, and the theme of this dialogue being so timely. Often when young people, when youth, when young women are talking about sexual and reproductive health and their rights, these issues are often seen as extras, or that young people are demanding of states or of their own governments more than their fair share. But these are really human rights issues. And I wanted to start off by just reminding all of us the different principles that are important. And why is the right to health important in this regard? Well, the right to health is important because it's defined by the Committee on Economic, Social, and Cultural Rights as an inclusive right. And I think this is very important. It's an inclusive right that extends not only to timely or appropriate health care, but also the underlying determinants of health, such as access to safe and potable water and adequate sanitation. And we can see the immediate link between the amazing work that young people have done on menstrual health and hygiene. We also know that the right to health and the underlying determinant of health related to adequate supply of safe food, nutrition, and housing is important. Many young people who are queer, LGBTA, who are gender diverse are often finding that their threat or their right to housing and food and safety and security is often threatened because of their sexual orientation or their gender identity. It's also important for young people to remember that access to health-related education and information, including on sexual and reproductive health, is also their human right. And a further important aspect in the participation of the population in all health-related decision-making at community, national, and international levels. I think I can speak for many of us today on this call that there has been a sustained advocacy effort to make sure that the youth voice is present at all of these decision-making levels in all areas of our life. And so we can then see why then achieving health and wellness, particularly around SRHR, is a human rights issue, but why it's closely related to and dependent upon the realization of many other human rights. And we know that the goal of health equity, some states may or may not pursue. However, human rights law legally binds states to ensure non-discrimination and equality in the provision of sexual and reproductive health care for all. And another important thing is that the working group on the issue of discrimination against women in law and in practice recognizes that this requires a differential approach to women and men in accordance with their biological needs, which we know, but also in meeting these different needs requires substantive equality approach, and thus obligates states to provide a differential sexual and reproductive health services, treatment, and medicines for women and girls throughout their life cycle. As a medical provider myself, a healthcare provider, an abortion provider, I know firsthand the difficulties that we have in sometimes translating human rights as well as policy into actual dignified and equitable health services. And this is very important as we start to think about universal health coverage, as we start to think about what the youth voice means and what the needs are of all of us in the different life cycles. I think what's also important is that both between and within countries, patterns related to sexual and reproductive health rights typically reflect social inequalities and power distributions. And we can't do this work without talking about the elephant in the room, the fact that there are power dynamics, even in the spaces that we all occupy, even in institutions of human rights, both nationally and internationally. And some of these power dynamics and how power is distributed is based on income, on gender, on citizenship status, on disability status even, on health status. And we know then how systemic discrimination and other factors then have impact on different people. Yet in all of these countries, regardless of what the systemic issue is, we know that there are certain groups of marginalized individuals, such as people in low-income countries or small developing islands. We know lesbian, gay, bisexual, transgender persons, intersex children having a particular issue with coerced medical treatments. We know the issues that adolescent young girls are facing in terms of accessing to contraception, modern forms of contraception, safe abortion. We know the issues that migrant youth are particularly facing at the moment, compounded by the climate crisis that we are currently experiencing. People who are experiencing homelessness, people who live with HIV, sex workers, for example, people with disabilities, confront even greater barriers. They are living under the crushing weight of prejudice and injustice every single day. And these injustices and these barriers do have an impact on their ability to have their sexual and reproductive health rights protected and promoted, and that their needs are also met with services. And so in light of the focus of this event today, it is important to, of course, continue to talk about the important and perhaps the youngest subgroup of youth whom sexual and reproductive health is practically of a concern. Adolescents have a right to express views on all matters related to their health and sexuality, and to access stigma-free, confidential, and adolescent responsive sexual and reproductive health services, information, and education. And we know with COVID-19 and the move from physical classrooms to online, that in many instances, that scripted learning on comprehensive sexuality education has taken a back seat, right, to subjects and to learning outcomes that are seen to be, like science and mathematics and the like. And I want to reiterate the importance of adolescents, particularly having this form of information, of course, in structured and scripted learning, but also not forgetting the youth and those adolescents who may not necessarily be attending school. And how does then the impact of online learning have on these young people? We also know the issue of digital, the gender digital gap, where even in households or in communities where there is access to mobile technology, where there is, in fact, even access to gadgets, that those gadgets will most likely end up being used by older people or by children who are male children. And so there's a lack of access to services and information that contributes to adolescent girls being the group most at risk of, or I suppose, of being denied information, but also of suffering serious lifelong consequences of a lack of information and affirming healthcare services. And we know that, of course, the Committee on the Rights of the Child has clarified further that there should be no barriers such as requirements for third-party consent or authorization, and that states should undertake efforts to overcome barriers and stigma attached to accessing these services by adolescent girls, adolescents with disabilities, and LGBTIQA+ adolescents. I think it's also important to eliminate abusive requirements as prerequisite. For example, when adolescents are trying to change their name or their legal sex or gender markers in identity documents, it's also important to talk about the issues of forced or coerced medical treatments that intersex children are still, being made to undergo, but also the other important issue of coerced or forced sterilization of young people who are HIV positive. And I think it's also important at this point to talk about the need to be more inclusive as we think and imagine a future of young people where every young person, regardless of where they are located in society, geographically in this world, they can have access to affirming transition health and care, including surgery of their choosing and hormonal therapies, without undergoing psychological appraisals or any other coercive treatments or assessments. And I think it's also important to talk about access to post-violence support for young people. Often when we talk about the big plans around strategy, around policy, I don't think there is enough focus on the needs and the particular issues that young people are having to deal with. Many are still in the developmental stages of their lives, both emotionally, cognitively, physically. And I do think there's a need to focus science and research to a comprehensive physical and mental support of survivors of both sexual and other forms of interpersonal violence, and on other forms of gendered violence. But I think we have a particular area here that we need to look at in terms of a range of quality services around sexual and reproductive health. Of course, prevention is important, but many of us do live in societies that are refusing to move with us, right? And be intentional and committed to these preventative strategies where we find ourselves still having to respond as first line responders to these issues. And the COVID-19 pandemic has deepened the cracks. I think what COVID has done was actually exposed existing structural fault lines that for many years, it's actually been the healthcare workers who've been carrying on their backs many ailing healthcare systems around the world. But particularly when it comes to services important for affirming and realizing sexual and reproductive health rights, it was very easy for many programs to either be stopped completely or to be reduced in terms of the budgets that those programs were getting. And in some instances, based on the inputs that I received, when I was drawing up my General Assembly report, we found that many people were talking about national responses to the pandemic that demanded policy change, innovation, and agility. And in some regions, human rights were upheld. But we know that in other areas, human rights were not upheld. And that, in fact, there are policy changes that happened during this health emergency that are in danger of being incorporated in long-standing non-emergency law. And I think this is one area of advocacy that the youth and young people have to pay particular attention to, because we know that it is critical that policy changes be examined during the pandemic for their impact on equality and equitable access, but also moving forward. I think there's enough cause for a red flag on this particular one. And just in closing, to say that civil society continues to play a key role as an agent of change. We've seen it in many countries, especially around the COVID-19 vaccine equity and access, but equally around issues of sexual and reproductive health rights. Youth voices must be respected as experts of their own lives, as experts who have solutions and who can prioritize where programming needs to be for their own communities. I think trustful partnerships between government agencies, state-run healthcare facilities, and the non-profit sector constitute one of the cornerstones of effective health systems. But we cannot relegate the functions and the responsibilities of the state or governments everywhere around the world to civil society. Civil society is a partner, but there are still very, very important governance and implementation issues at the level of the state. And bring us back together to today's theme, Youth Voices on Srhr, moving from commitment to action. We must collectively demand meaningful participation of the youth, proactive and decisive leadership. We must demand transparency, which has been seen to be lacking in many of the COVID-19 responses around the world. And because we need transparency for accountability, equality, as well as justice, we must continue to demand that states, third parties, civil society, all of us respect and protect key principles of non-discrimination, equality, and privacy, as well as the bodily integrity, autonomy, dignity, and well-being of all individuals, especially in relation to sexual and reproductive health rights. This is important for everyone to realize their right to the highest attainable standard of both physical and mental health. Thank you very much.
Thank you very much, Dr. T, for that incredibly insightful and thought-provocative keynote. I don't want to run the risk of accepting any of the incredible points that you've made, but I'm astounded at how you've given such a unique overlay from the global to the continental to even the SADC picture. And you've really challenged us to start at the beginning and look at where we've come from and how we've gotten here, and taking us all the way back to the roots in colonialism and patriarchy. You've taken us on a roller coaster to consider power dynamics and the distributions of power. I also found it really insightful at how you've managed to weave the macro and micro drivers of poor adolescent and youth Srhr outcomes, and how you've painted a picture of how even things that we don't often consider as drivers, such as climate crisis, such as homelessness, such as the denial of autonomy of adolescents by adults and other people with authority, to really determine adolescent and youth SRHR outcomes. So incredibly thought-provoking. If any of the attendees would like a copy of Dr. T's remarks, I'm sure she'll be willing to share it with us. And of course, the recording of this webinar will be shared with all participants at the conclusion. But thank you once again, Dr. T, deep appreciation. And if any of you have any questions or comments, please input them onto the chat box. We will have a Q&A with all panelists and all discussants at the conclusion of the second segment, which we're heading into now. So thank you once again, Dr. T, deep appreciation. So as you've heard, we've talked about the Generation Equality Forum, we've talked about the action coalitions, and we've talked about what's been moving internationally over the last 5 to 10 years. We've talked about some of the recent developments and the situation analysis South Africa. We've also drilled quite deeply into the position we find ourselves within Southern Africa. But I think now, for the purposes of this panel discussion and in line with the topic at hand in terms of moving from policy and commitment to action for adolescents and young people, we want to really zero down into the South African context. And for this segment, we will have two approaches and two overarching objectives. The first objective would be to look at what are some of the drivers of poor SRHR, which some have already been touched on, and just a general reflection on the poor drivers of SRHR and the undermining of bodily autonomy and integrity for adolescents and young people. And then in the second objective, in second segment, we really want to look ahead, and we want to look into the future, and we want to look into 2026 and into 2030 in the form of the next 62 to the next 112 months with regards to what we can do. And I think Dr. T also challenged us to look at some of the emerging touch points that youth-led and youth-serving organizations and activists and advocates more broadly should be paying attention to that have emanated from the COVID crisis. And in looking ahead, we really want to look at the commitment and the pathways that can be harnessed and leveraged to accelerate SRHR and bodily autonomy for young people in their diversity. And on today's panel, which is a powerful lineup of esteemed panelists and experts and activists and advocates, we have 8 panelists. And the first panelist would be Mr. Katani Hlongwa, who is the Director of Social Policy Research at the National Department of Social Development. We have Sadie Brown, who is a 25 by 25 young leader with She Decides and the She Decides movement more broadly. We have Ms. Managa Pillay, who is the National Adolescent Girls and Young Women Specialist at the National Department of Basic Education. We have Mrs. Yolokazi Mfuto, who is a youth activist and former youth advisory panel to the United Nations Population Fund. We have good friend and comrade Koketso Rutumbu, who's also a member of the National Youth Task Force, as well as the SRHR Action Coalition, and an Adolescent Girls and Young Women's Ambassador at the South African National AIDS Council. We have Ntabi Singh Mohashoa, who is a member of the Siakwazi Youth Network, as well as a radio personality. We also have Ms. Gertrude Mashimane, who is the National Youth Programs Manager at the National Department of Health. And last but not least, we have Hlobisile Inamandla Masinga, who is the founder of the Pink Roses Foundation and an esteemed comrade and friend of mine. So if I may start off with the overview from your side, Srhr. So Srhr is also joining us from the UNFPA South African office, and she works under the Gender Dynamics and Mainstreaming portfolio. Srhr, I'm going to give the floor to you first to really give us that overlay around what the South African data is saying around youth access and barriers to SRHR in South Africa, and what the evidence is saying in terms of the evidence brief that has been generated by UNFPA. Srhr, could I please hand the floor over to you?
Good afternoon, everyone. My name is Srhr. I'm from UNFPA, the United Nations Sexual and Reproductive Health Agency. I'm here on behalf of the South African Extra Coalition on Bodily Autonomy and Srhr to present the evidence we have gathered on young people's access and barriers to Srhr in South Africa. The coalition reviewed the research and studies conducted in South Africa in the last 5 years. Most of this research is qualitative. The results are summarized in this brief that you see on my right side, and I'll share some key highlights. First of all, we need to understand the key drivers for adolescent and youth Srhr. According to UNFPA, the ecological model that you see on the screen indicates that Srhr for adolescents and youth depends on a number of factors, ranging from the individual level at the bottom to the social cultural level, systems and structural level, that's where the services are located, and the legal and policy level. All these levels are important drivers and interact between them. We'll take a look at some drivers in more detail. Let's start by looking at the policy and legal frameworks. As we saw on the prior slide, the policy and legal frameworks are very important for adolescent and youth health, and Srhr more specifically. On my right, you will see that South Africa has issued a number of these frameworks to improve the health of adolescent and young people, including policies, national strategic plans, and guidelines. These are recognized by many studies as critical steps for adolescent and young people's Srhr. Let's take a look at some of the key recommendations that came from such policies. The existing policies prescribe models for single service delivery points and integration between HIV and SRH services. They also recommend strengthening of information and referrals for adolescents and youth. That helps them to get the services in one place or to get referrals and information enough that allows them to go easily to the other services if they need. The policy also includes recommendations. The policies include recommendations for adolescent and youth-friendly clinic spaces and what they should look like. For example, operating hours that accommodate learners' timetables, privacy, that means the services for young people are placed away from adults, having non-judgmental staff that are equipped to treat young people with respect and non-judgmental manner. Expanded and improved contraceptive method mix, that means young women and girls can choose, and increase access to medical male circumcision. These are all recognized by many studies as important elements of adolescent and people's Srhr. At the same time, the study identified several barriers for the achievement of young people's access to Srhr. What are these barriers? First of all, confidentiality and privacy needs to be observed. Some studies documented cases where services are not placed away from adults. Therefore, privacy cannot be guaranteed. Or there are cases where some service providers have disclosed the content of the conversation to parents, therefore violating the confidentiality of the service. This is also linked to the next point that came up in many studies, which is the finding that not all healthcare providers are yet equipped to offer non-judgmental services. What does that mean? This means, for example, a case of a healthcare provider who is reluctant to offer SRH services to adolescents who engage in sexual activities, or a healthcare provider who restricted contraceptive provision to women over a particular age or married. It was also identified in some studies that negative attitudes towards youth were registered, especially youth with disabilities, LGBTIQ+, and sex workers. The prior topic connects very deeply with the social norms and perceptions about young people's agency and rights to Srhr. Sometimes there are cultural and social norms that prescribe abstention from sex before marriage, or there are unequal gender norms that allocate more power to boys than girls. This in turn can have negative consequences such as fear of judgment, which will then prevent young people to seek health services. Another important point noted in some of the studies is that physical and communication structures need to be adapted. Otherwise, they may be hampering access of persons with disabilities. Finally, we'll talk about the facilitating factors. A recent research issued by HSRC indicates that many of those items prescribed by the policies and frameworks can really help addressing the barriers that exist. These are: make different services available in the same location, ensure confidential, friendly, and accessible services to youth in their diversity, offer comprehensive information so that youth can decide, train, sensitize, and engage staff to provide non-judgmental services, and engage youth meaningfully and their communities at large. This was a quick snapshot of the findings. Thank you very much for your attention. The panel now will discuss in more detail these and other critical elements. Thank you.
Thank you very much, Srhr, for the incredibly useful presentation, for really setting that context and that scene in terms of what has been emanating in terms of the data touch points with regards to barriers to young people's access to quality SRHR in South Africa. I would now like to turn to Kitani Hlongwa, our friend from the Social Policy Research Unit at the National Department of Social Development. Kitani, DSD plays such a pivotal role in terms of coordinating and acting as a custodian of population and development policy in South Africa. And I know you personally from our interactions on the Adolescent and Youth SRHR Framework Strategy, which was one of the landmark watershed victories that we had secured in 2015, 2016. But I really want to hear from you in terms of reflecting upon the preceding presentation, which Srhr had presented on barriers to SRHR. In your opinion, how should we plan and program better with adolescents and young people to realize their fullest SRHR? And what have you learned from the experience of, say, the Adolescent and Youth Framework Strategy?
Okay, thank you very much, Levi, and good afternoon, colleagues. I think Srhr has just done a very good job in setting up the scene on what are the current issues. I just want to, though, before I answer your question, also point out that I think with regards to access to services, in the main, there are socio-economic as well as cultural factors that influence the patterns of use, whether people are going to continue or they're going to have an interrupted access to these services. And so these socio-economic factors can either boost or actually have a negative impact in the access to services. And what then, beginning to move to answering your question, what then becomes very key, I think, is the mindsets, changing attitudes that are embedded in these socio-cultural as well as political structures. I think this then becomes very much important for us to be able to promote the use of, for example, contraceptives, as well as other proactive choices around SRHR. And it's also, I think, very important for us to highlight, I think, picking also from Dr. T's presentation, these two things. Firstly, women living in poor socioeconomic conditions. When she was presenting, I could really see that indeed we have very higher in-facility maternal mortality, as well as lower in-facility deliveries, mainly because of the socioeconomic conditions that women who are poor find themselves. But also, secondly, I think the framework, even though it has these pillars, there are, for lack of a better word, groupings of individuals or persons that are still very difficult to reach. And in mind would be persons with disabilities. Here in South Africa, for example, they continue to have inequitable access to healthcare in general. but it becomes even worse when it comes to SRHR services. And their experience ranges from additional barriers when seeking care, barriers relating to access. Sometimes information is not readily packaged, accessible to persons with disabilities. And there are other, of course, attitudinal from the duty bearer side, as well as they also still have to jump through the hurdle of the financial barriers. So sometimes we can say these services have been made free by government, but then we forget to look at the background part to access. It's easy for us to say if you are at a clinic, then you will have free access to these services. But for a person who is disabled or for a person who is poor, these facilities tend to be very far from individuals. So there are these added in costs that even though the actual service might be free, but the access still needs to be negotiated and remains very much tricky. Maybe Levi, to just close on what you have highlighted, I think you are already able to pick how the framework strategy has then been able to assist us, especially with its multiple pillars. I think one of the key things that has come out of it is that we are able now to have identified the key gaps that are hampering our progress in achieving our own in-country commitments. But also what is key to it is that we are then able to domesticate some of the other commitments that we have. For example, the ICPD 25 in Nairobi, we recommitted to having zero unmet need for family planning information and services. And we are then now moving to a different layer to just not having the actual service being made freely accessible, but then we look at then what are these other obstacles in the process of attaining these services that are still blocking full use and full access. We still, as a country that has, if you like, sadly so, are beginning to normalize GBV. And so we have had to then recommit to zero sexual and gender-based violence, as well as other traditional, if you can call them that, harmful practices against women and girls. So yeah, the country in this regard has then rolled out some of the plans and the budgets to implement these commitments. And it has that were made, of course, at the summit in Nairobi. And to intensify efforts to mitigate the gendered impact of COVID-19 pandemic. I think that's one of the key things. When Anne spoke earlier, I think she made a very good point for us to say, when these pandemics come, they tend to affect access to your routine services. And what we are seeing with an increase in teenage pregnancies, I think is a tip of the iceberg. Before the COVID-19 pandemic, we had high numbers of HIV and AIDS. And when majority of the services related to preventing HIV and AIDS are becoming inaccessible, so it's a matter of time, then that's the prevalence, although it was plateauing, we may then be likely to see it increase. So yeah, in the long and short, yeah, we really need to say, even though we have these frameworks in place, but how do we continuously monitor the progress that we are making? And how do we actually get biased to those who are difficult to reach, but also those who are extremely vulnerable to the impact of poverty as well as these pandemics. Thank you very much, Levi.
Thank you, Ketani. That is very useful and very insightful in your sharing. And I think your last bit in terms of that emphasis on how we recover the gains lost due to disruption in services is a useful segue to the next speaker. Comrade Sadie Brown, as I had mentioned earlier, is a 25 by 25 young leader with the She Decides movement in South Africa. The 25 by 25 program was launched to commemorate Beijing at 25 in 2020. And Sadie, Ketani spoke a little bit about, some of the reversal of gains that we could be expecting, especially in regards to HIV and SRHR integration. And I want to know, as a young woman and activist who is living openly and positively with HIV, what are some of the creative and innovative ways you have ensured that yourself and your peers are able to access comprehensive SRHR services during COVID-19? And what are some of the lessons that you want us to take further post-pandemic as we try to charter these so-called new normals?
Thank you so much, Levi. Good afternoon, everyone. So I have always used social media to most of my activism, because as a young person coming from quite a remote township in the Northwest, in as much as I wanted my story to reach the people I wanted to hear my message, I was always quite realistic in saying, where would I start? And like any other young person, I was always on social media and didn't have that big of a platform then, but I knew it would help me in doing most of my work. So it has always been social media. And even during COVID, I still went back to social media. We were locked down in our homes. We couldn't do anything. It was hard asking about things like access to SRHR services, because as young people, we are still made to feel quite bad for asking for services that are put in place for us. I had to use my social media, including my YouTube, to share messages and educate my peers on our right to the access of comprehensive sexual health education. I'm also a She Decides 25 by 25 young leader, as Levi had mentioned, and we were involved in quite a lot of programs that amplified our voices as young activists. Amongst all the work that we did, I was also a part of the curators for a blog we had last year called She Decides Now, a platform that we had to speak, a platform that we used to speak truth to power on issues that we felt strongly about. We spoke about the importance of access to SRHR services. I also spoke a lot on the realities of queer women living with HIV and how erased our existence has been in conversations about HIV. It was in the previous year where I can say I really grew in my advocacy journey and focused more on the importance of intersectional activism. I believe it has been important to realize that all social changes need to be given enough time to be able to fight them all. I mean, we all know Rihanna, and she did say in one of her acceptance speeches that when you're fighting for something, you need to call your homies and tell them to pull up. And I love that so much, because it shows us how we can be allies, and it also shows us how we can all come together as young people to not just fight for what affects us, but to fight for what affects us all. I hope we learn as the world to never allow one crisis to make us so negligent of other existing crises. We were neglected as people living with HIV. Gender-based violence was at an all-time high in our country, and yet the main focus of our government was alcohol consumption and keeping people in the same place that subjects us to so much harm. I hope we never react that ignorantly to the realities of South Africans ever again. Thank you so much.
Thank you very much, Sadie, for your incredibly unique sharing and for your continued advocacy and activism during this really trying, uncertain, and just really messy time. I've been following your post ardently, and I think I just dropped a link to your YouTube account for people to follow if they're interested to become more of your fan base. but I really think you're doing some dynamic work, and you're really showing us what the future of digital health and SRHR interventions could look like when led by adolescents and young people. Over this time, interestingly enough, we've seen mobile penetration, at least in the global south, peak by around 80%. So as much as people lack access to desktop internet, the power of the smartphone has really become a lot more prominent. And I think you're really a good example of harnessing opportunity during a moment of crisis. So deep appreciation, and thank you for joining us, Sadie. I'd like to move on to the next panelist, Ms. Managa Pillay, who is the National Adolescent Girls and Young Women Specialist at the National Department of Basic Education, housed within the Learner Care and Support Unit. Managa, you and I were just talking last week about the need to really consolidate and pull together when it comes to comprehensive SRHR for adolescents and young people. Yourself, you've been an activist and an advocate and an ally and a supporter of young people in your former career, and you continue to take this sort of tone in your approach to your work through the National Department of Basic Education. But I really want to know, in light of the recent adolescent pregnancy statistics, as well as the underlying data which I spoke about earlier on adolescent and youth sexual violence, what are some of the programmatic responses we should prioritize and invest in to get the SRHR of adolescent girls and young women back on track? And who are some of the unusual suspects we need to bring on board to ensure that we have this progressive agenda that is shared, that can move us into the future?
Thank you. Thank you so much, Levi. Should I put a disclaimer that I'm going to get myself into trouble with the last part?
But you are protected. This is a safe space.
Yeah. So yeah, greetings to everybody. Apologies from Dr. Whittle. He does send these well wishes, and Levi, we're very excited to be part of the Generation Equality engagement. And we look forward to working with you guys in terms of taking this forward. So I suppose I want to, I think in the interest of time, just to say that I think the speakers have adequately covered the issues. But I think it's also, important to make the point that schools are a microcosm of society, and more specifically, the communities, in which they are located in. So the nuances, become quite apparent. I also want to kind of make a point that in terms of our School Realities report, we have about 13 million young people in our sector with a fairly even balance, although we're finding now that boys have taken the edge. So I think just to make the point that has implications in terms of the retention of young women and girls within the schooling environment. And I think we're also acutely aware of the fact that there are so many challenges that young people face in relation to access to sexual and reproductive rights, and also more so the complexities that they have in terms of maneuvering the space. I think as the department, as education, we are acutely aware that education is a protective factor, and that the school environment certainly allows us to have access to young people, both in and outside of the classroom. And I think many of the speakers have alluded to the notion of comprehensive sexuality education. And I think that, we see our responsibility, as core with regards to the provision of comprehensive sexuality education and, access to information, knowledge, skills, and services. So I think that, Levi, to answer your question in terms of what do we, invigorate, and I think that I want to make the point that I think we have a substantive amount of comprehensive, well thought out policies, frameworks, standard operating procedures, and even programs in terms of the Adolescent Young Girls and Women's Program that we are, mobilizing across South Africa. I think that in terms of the integrated school health, policy, which one of the previous panelists alluded to, gives us the opportunity to really bring together integrated access to services. We have the policy framework for care and support for teaching and learning, which again embeds the kind of softer psychosocial service-related issues within the teaching and learning space. The HIV policy framework, in terms of the school's role in responding to the National Strategic Plan. We have the national also speaks to the issues of violence and gender-based violence. Very importantly, we have the protocol for the management and reporting of sexual abuse and harassment in schools. We also have a standard operating procedure for the provision of sexual and reproductive health and rights and social services in our schools. And then I think with regards to the latest issue, the prevention and management for learner pregnancy in schools is a very important one. And it also speaks specifically to the reintegration and the retention of a young girl post her pregnancy, speaking to the notion that retention is a critical national competency that we are looking at. In terms of answering your question, Levi, what are some of the programmatic responses that we need to invest in and get back on track? I think that there are many, but I think I also want to pause, and kind of reflect on what Anne said as well, because I think it's really important in the sense that I think it is important to change the narrative in terms of the blame game and the lenses with which we look at issues. And Anne spoke about it very nicely about flipping the traditional language that is really couched in blame and shame when it comes to issues of, being HIV positive, teenage pregnancy, and those sorts of issues. I mean, can you really blame or expect a 10 or 14-year-old to protect themselves against an educator, a family member, or somebody that is known to them? So in terms of some of the programming elements, Levi, just to very quickly, allude to the programs. I think it's the HIV prevention program, which is supported by a policy and a conditional grant, within the schooling sector. We have the integrated school health policy, which I spoke about. We have a very interesting project, which is run by the MRC called the Social Impact Bond. And it really presents an investment case for AGY programming. And I do think that it is a real-time modality which enables programming to change, on a daily basis. And it's a very exciting program. The Education Plus initiative, which many of you know on the group, the UN families are driving with the support of our Deputy Minister. And then the Gender-Based Violence and Equity Program. We have the Let's Talk program, which is being facilitated by UNESCO and really speaks directly to the unintended pregnancy, within the system. I think the AGY program has started to show very positive dividends. And in terms of the standardization with the new Global Fund grant to ensure that it's run across the country, across the various provinces in a standardized way is showing us dividends. We are starting to see very positive benefits and impact. So it's certainly a program that we need to look at. And I think also with the new Global Fund grant that's, coming into the country very soon, the AGY program, we are looking at saturation activities to ensure that programming moves beyond just high burden districts as well. So very quickly then, Levi, to, talk about the unusual suspects, I want to say parents and families, and I really, kind of want to underscore that by, the one statistics that we've been looking at very carefully is that of Home Affairs data, where we're finding birth registrations showing much, much older women registering births. And we know that this is often being done to protect someone that is known to the child and the family. Community leaders, religious and traditional healers, principals. And I know, again, I'm putting it into inverted commas because you wanted me to talk about the unusual suspects, and I call them unusual because actually they should really be the core drivers of, mobilizing protection against children, and we're actually sadly not seeing it. We know that principals are succumbing to pressures from family members, in terms of rape charges, for example. We know that, family members come in their droves to the school to see the principal around rape charges. And then, of course, it's conservative political party representatives. I think in the face of the evidence that we've been gathering around a very organized anti-CSE movement that has leveraged many of the dissidents in our midst, and I argue that this is perhaps the most important area that we need to look at. I think that, I want to say that the Department of Basic Education, I think government, within our spaces, definitely has the agency to leverage the school as a protective space. The reflection is whether or not we are optimizing that space is what we need to look at. I think we need to be honest in that while that there has been many, many progressive developments over the years, there's also many, many gaps. There are many naysayers, even at a leadership level. We still struggle with implementation, governance, and accountability. And of course, my fellow panelists have alluded to COVID, which has starkly, exposed the inequity, especially as it relates to teaching and learning and services. And I think we have to be very honest and admit that the scripted lesson plans and teaching was initially designed for a face-to-face modality. And I think we need to pause and think about that. And I want to come back to the issue of the conservative party politics. This is really worrisome. We know that they lobby and mobilize where it matters the most, and that is within, the parent and the community space. We also know, Levi, we've engaged on this, on a different forum in the fact that there is a very organized movement the dissidents, and it's not a backlash. It's a counter, well-resourced movement, and it pushes for pro-family ideology and the fundamental social unit. And I think that has serious implications for us as a country, and also in terms of the gender diverse populations, the young people looking at sex and sexuality, issues of sexual pleasure. That's supposed to be natural and, individual issues that are, that we need to look at. So I think in closing, I wanted to share something very interesting that, a representative from the African Christian Democratic Party at the last Basic Education Portfolio Committee, in spite of seeing the jarring statistics that we, presented, went on to adamantly argue that as the department, we were undermining the roles and responsibilities of parents, and that we were actually overstepping our role as the state in relation to CSE and the content that we were preaching. So perhaps we do need to rethink policy. I think, again, some panelists, Dr. Ratleng spoke very specifically of systemic change, that is needed to address some of the current inadequacies that exist. And, I think my last comment is that we cannot collectively think about this as business as usual. We need some drastic action. And I think it excites me that there are so many activists on this forum, because perhaps that's what we need to go to have some fundamental change. Thank you so much.
Thank you very much, Managa. And once again, you are protected, so you aren't going to get into any trouble, I can assure you. I think you raised such a salient point at the end around how this opposition isn't something foreign. It's something that's well-resourced, it's well-coordinated, and it's well-structured as a counter-movement towards rights, towards values, and towards things that we hold near and dear as progressive liberal democracies. I think our friends at Open Democracy last year told us that between 2017 and 2020, we've seen over $250 million flow in just to the African region alone to counter termination of pregnancy policies, to counter LGBTQI plus programming and policy advocacy, to counter and undermine the agency and autonomy of adolescents and young people and their SRHR needs. So it's really well funded. And I think Dr. Tlaleng and Zain, we've interacted at many UN fora, be it CSW and CPD and some of the other fora, and we've had to deal with this opposition. But the level of coordination is definitely something that we need to look a bit more into as young people, because we've seen how this inflection point of COVID has really been used as an opportune means to roll back on some of the gains that we've made in terms of progressive policy and legislation. I want to come to Yolokazi and Koketso. We still have 5 panelists to go through, and this has been such a dynamic discussion already, and I can see the comment session blowing up with questions and comments. But Yolokazi and Koketso, in your respective roles and in your respective activist and advocate journeys, you have served and continue to serve adolescent girls and young women in their diversity. And both Managa and Ketani spoke to the intricate level of policy, of strategy and protocol that we have in place at various levels. But I want to know, from a youth advocate perspective, what are some of the policy gains and gaps in addressing barriers to the development and empowerment of adolescent girls and young women? And in particular, looking at some of the gains and gaps in comprehensive sexuality education, in programming around teenage pregnancies, in programming around intimate partner violence, and the overall violation of the SRHR of adolescents and young people, in particular adolescent girls and young women. Maybe let's start with you, Yolokazi, and then we go to Koketso.
Good afternoon, everyone. Good day, rather. I think that's more appropriate. Well, I'm hoping that my internet is going not to fail me, because I've been getting a lot of your internet is so unstable. I'm hoping that I am audible and nothing is going to hinder my comments. So basically, Levi, when you mentioned gains, I was like, oh, great. Because we've seen progress, especially with regards to the comprehensive sexuality education. Now we're speaking about it. I remember when the Department of Basic Education introduced the comprehensive sexual education, and many people on social media and in some areas, they said we are teaching people, young people in particular, sex and how to terminate pregnancy and all sorts of things, forgetting that this is not what CSC is about, as Dr. Tlaleng has put it. So the gains are that we now know that people know about the importance of comprehensive sexuality education. They also know about the policies that we have. For instance, now when you go to the health sector in the country, especially in public offices, you realize that clinics and hospitals, they have friendly hours. Nurses are getting more friendlier to young people, and they kind of accepting young people without, those shady faces that they usually gave us when you go to clinics. So now things are getting better and better when it comes to gains. However, now with the gaps, it is very important that when we implement policies and try to influence decision makers and of course attend conferences and speak on SRHR and all things that speaks to regards to young people, we use language that is understandable to the young people, also understandable to people who have to implement these policies. So you find out that when you go to rural areas where I'm mostly based, I'm in the Eastern Cape in South Africa, you realize that it is very difficult for nurses and to interpret these policies and what they mean to young people. And at some point they struggle to actually deliver services to these young people because of the language barrier. So it is very important that when we write and formulate these policies, they're in a language that is understandable, that can be easily translated to the vernacular languages such as isiXhosa. So those are gaps that are there when it comes to the policies that are then implementing programs that speaks to SRHR, especially in rural parts of South Africa. But going to the teenage pregnancy, it was devastating when we saw in the headlines last week that young girls are getting pregnant, and sometimes the headlines were very much problematic, saying that young people are now the language was very much inappropriate from the reporting side of the media, and now blaming young people for getting pregnant and not necessarily attending to the issue from the root cause. Probably these young people at some point were not even in having consensual sex, but that was not a conversation that was had on the media, and they were trying to cure the consequences and not necessarily trying to understand the perspective from the young people. So when it comes to teenage pregnancy in South Africa right now, it is still a very long way to go, because when we talk about young people and talk about things that affect young people, we often not include young people in the decisions. Or when we do, they have complained to us at some point that we talk to them, we do not talk with them. So it is very, very important that we also recognize that they are human beings, however, they are still adolescents. So it's very important that when we talk with them, not to them, so that we can understand the underlying problems. Then also, when we go back to intimate partner violence, South Africa right now, we've seen the rate of gender-based violence reported cases. They've been skyrocketing since the lockdown. However, now those are the only reported cases. We don't know of the number of cases that are not reported in South Africa right now. And young people, they do not necessarily live in isolation. They live in our society, which perpetuates gender-based violence. Society that where young people are seen as subhumans, where young people are judged based on what are they wearing and what they're dating, whatsoever and so ever. So it's very important that when we talk of intimate partner violence, we do not necessarily isolate young people, because young people, they also, when they get into relationships, they often get violated by their partners, but then they find difficult to come and report the cases because firstly they'll be judged that they're dating maybe a person who's slightly older than they are, and then that then a secondary victimization takes place. Then the case is never resolved because this was never attended to in the correct manner. So it is very important that when we speak with young people and we speak to them, so that we understand that they are at the receiving end of all these atrocities. So they have to deal with a whole lot of things. Now, when they deal with intimate partner violence, it takes them by storm, and it's very difficult for them to actually come up. So we have to be very considerate and see them as human beings, and most importantly, as equal partners. And also to respond to you on the progress on and the violation of Srhr, so accessing the reproductive health in institutions of the healthcare centers and stuff. Yes, I have said that there is progress. However, now the problem is still on the implementation side. The implementation side, we have great policies, amazing policies that seeks to address all the problems and the challenges that we have in South Africa pertaining delivering services and accessing services by young people. However, now the people that are entrusted with that role of making sure that these policies are implemented, they still not so much at par with what needs to be done and how it needs to be done. So at some point, you'd find that as much as the policies, they know they are written down, they have the documentation, but translating that into action and also being able to explain to the young person who has come to attend the services, the nurses and the healthcare practitioners, they struggle. So it's very important that we kind of make sure that the implementers, especially from the healthcare practitioners, they understand fully the policies and what needs to happen and how it needs to happen, and not act as if this is doing favor to young people when they want to access their sexual health services. And this ties up with everything. And the one thing that I have noticed in my work with UNFPA and my work in the Eastern Cape and the countries at large, I've seen that many people assume this is the Western thing. It's a white thing that we have to sit with young people and discuss issues of sex, issues of their sexuality, issues of when they want to discuss family planning. And then they say, no, this is a very whitish thing, or it's very Western. We do not do this in our African culture, in our tradition. And then they're very traditional. However, that is a fallacy. Us in our people in Africa were discussing these things. Hence, we had things like Indonjani in Sixhosa, where Intombi was actually had conversation with their mothers and mothers' sisters about their sexuality and family planning and everything else. However, now when it comes with maybe, let's say, policymakers, people assume that this is a Western thing, therefore they cannot participate in that. Hence, now they shy away. So the importance of language and actually ascertaining people that this is not something far from you. It's something that it is mandatory and very important to ensure the well-being of the nation and, of course, the future of South Africa. So it's very important that the language used is very important. And we tie everything together. When we speak of comprehensive sexual education, we also speak on the violation of Srhr and also speak on the intimate partner violence to ensure that everything goes well and they are aligned. Thank you so much, Levi.
Thank you, Yolokazi, for that incredible, elaborate overview. I'm not going to add anything to it. I'm just going to pass it straight on to Koketso with the same question. Comrade Koketso, I know you're on the road, so if you can't turn on your camera, no worries. Please feel free to use the audio function. Same question to you, please.
Thank you so much, Comrade Levi.
You are audible.
I think for me, it is critical. Levi, can you hear me?
Yes, we can. Please proceed.
Thank you. Thank you. So I think what is central to us in South Africa to realize is that one of our strengths is that as a country, we have incredible progressive policies which are evolved and are grounded by a human rights approach. And fundamentally, our biggest challenge is implementation. And I think that's already been alluded by Yolo, who spoke quite significantly about how we struggle in terms of integration and really bringing in our multi-sectoral and dissecting efforts. So we have an overarching national youth policy, which aims to eliminate poverty and reduce inequality by growing an inclusive economy, building capacities, enhancing state capacity, and promoting leadership and partnership throughout society. So this policy is responsive and an intersectional document which recognizes the need to respond to the holistic needs of young people, including social and structural drivers of sexually transmitted infections, pregnancy, and GBV, as previously alluded by previous speakers, by highlighting capacitation and empowerment as a premise. So focus area 3 of the NYP, which is the National Youth Policy, focuses on physical and mental health promotion, which does not exclude COVID-19. This strategic goal emphasizes on the importance of physical education and that it must be compulsory in every school, and that implementation of comprehensive sexuality education is at the central of our approach in ensuring that our young people that are currently now pregnant have adequate information and can make informed decisions, and that the importance of psychosocial interventions in school and community level is important to address the challenges of mental health, of bullying, of gender-based violence, as previously alluded to, rape, etc., ensuring that we utilize as well a peer-led approach into the interventions that are focused at young people. It further asserts that the sexual and reproductive health and rights of youth, also further emphasized by the Adolescence and Youth Health Policy, which is spearheaded by the Department of Health, should be supported by both schools and families to enable youth to have access to necessary information, to seek health care, and when necessary, to practice positive behaviors. And in addition to this, gender equity remains central to youth empowerment, and youth, especially young women, should be taught to be assertive when making decisions about sexual and reproductive health and rights, and to report violations of these rights. The NSP of HIV, TB, and STI also categorizes adolescent girls and young women, as well as youth, as one of the key and vulnerable populations to HIV, and therefore this requires extensive efforts to intensify and optimize key biomedical and behavioral interventions. So access to adolescents and youth-friendly health services and information related to sexual and reproductive health rights needs to be availed and expanded through mobile clinics in public and private health facilities, as well as in schools and other venues. SRA services such as HIV prevention, tools such as PrEP and PEP, HIV treatments, ART and viral load monitoring, contraceptives, STI screening, PEP smear, post-violence care are some of the key services that young people need, and so gravely allude to the fact that when they get to health facilities, those are the services that they may be denied. So at the center, what is central is the optimization of these health services, and it is important that we strengthen and reinforce social behavioral change as we find ways to integrate SBCC with our biomedical interventions. We need to encourage positive behavior from young people to ensure that our solutions and all these interventions are sustainable and they're able to elevate the lives of young people over and above just taking care of their health needs. We also need to ensure that we are aware of some of the key and most pressing vulnerabilities of young people, which at the center is poverty, which is some of the drivers of young people engaging in risky sexual behavior and young people being unable to access adequate health services. So all these policies are grounded in the principles of human rights, and we have very progressive bills of rights in the country. So the greatest challenge also that we have as a country is that we have a responsibility to coordinate efforts, to integrate, to strengthen, and ensure that we have proper monitoring and evaluation tools so that we are able to ongoingly monitor progress and the goals we set, and seeing that young people are not just beneficiaries, but are fundamentally key contributors to our programs and all the key initiatives that we implement. And in closing, Comrade Levi, I think I want us to all reflect on how, as young people, we want to take a stand, but what is a barrier to us is capacity building, which is, as much as this is focused on SRH, but capacitation is one aspect that it has an intersecting response to all the key issues that young people face today. So as we go back and reflect on how to better respond to some of the critical needs of young people, let's think about how in our own organizations, in our own immediate spaces, are we really capacitating young people on a pragmatic level over and above the programs that we are mandated by our daily work or our jobs to implement, but how are we mentoring young people? How are we contributing ongoingly to the progress of young people? And how are we ensuring that as we work as program developers, program implementers, we not work in silos, but find ways to integrate all of our efforts for the betterment of our young people? Thank you.
Thank you very much, Koketso. Those are very insightful remarks and some incredibly useful considerations there. I really do like your point on monitoring and evaluation systems and how many of those need to be youth-led. And I think you and I have spoken at length about the need for youth-led accountability, especially when it comes to SRHR policy and programming. And I think the call from both Yolakazi and Koketso can be summed up in order to move from policy on paper to policy in practice. We really need to ensure that there are systems in place that can enable adolescents and young people to move from being just the beneficiaries of SRHR policy and programming to the partners and leaders of it. And I think this is exactly what we've purposed to do through the Generation Equality Forum's Action Coalition on Youth, and especially this one on sexual, reproductive and health rights. So thank you both, Koketso and Yolokazi. We have 3 more panelists, whether you can believe it or not, and I am going to ask our 3 panelists if they can keep their remarks as succinct as possible, maybe to 5 minutes maximum, so that we can enable some sort of interaction with the audience. I can see the chat box and the Q&A segment blowing up, and I think we'd really want to ensure dynamic engagement, not only with your contributions, but also with your previous speakers. So my next panelist is Nthabiseng Mohashoa, who I had mentioned is with the Siakwazi Youth Network and a radio personality. And Nthabiseng, I haven't really interacted much with you, but I do understand that you work in the media space. And given your work in the media space, I want to know what would some of your key recommendations to consider be when designing, implementing campaigns and messaging and promoting improved health-seeking behavior, especially regarding the adolescents and youth SRHR in the mainstream. And I think there's a lot of segue from Sadie's remarks in terms of using digital technology and you know, social media platforms to share info. But as a radio personality, media personality more broadly, what are some of the considerations and recommendations that you'd give us when we consider designing and implementation?
A very big thank you to you, Levi, and of course allow me and grant me this opportunity to thank each and every member that joined us today. It is imperative that we have sessions like this to unpack and also to understand where we are as youth and what we are working towards too. Allow me to say that one condom, one round, and I'm saying this with determination because young people need to understand that they are the voice of tomorrow. And also before I answer your question, allow me to clarify and also state this to our members that sexual and reproductive health and rights are what we call a universal human right. They are an indivisible part of the broader human rights and also of what we call the development equation. Their particular power resides in the fact that they deal with the most intimate aspects of identities as individuals, and they also enable human dignity, which is dependent on the control of our bodies, our desires, as well as our aspirations, which is something that a lot of young people fail to understand. And as advocates, we need to make sure that they understand. Sexual and reproductive health and rights, they're out to provide what we call health information. They need to educate, they need to counsel, and they also need to provide a range of safe and affordable contraceptive methods, quality obstetric, as well as what we call antenatal care for all people of all genders, because in this way, we are able to move towards the light that we want to see. Levi, the mass media has an excellent potential to actually promote good sexual and reproductive health outcomes. But around the world, more particularly in South Africa, media often fails to prioritize sexual and reproductive health and rights issues or even report them in what we call an accurate manner. Which is why today I'm saying that it's important that we enhance the journalist interest in and also motivation for reporting on issues of reproductive health issues through what we call training and also competitive grants for the outstanding report. It is also important that we build the capacity of journalists to report reproductive health research and also the capacity of reproductive health researchers to actually communicate, which is keyword there, to communicate their research to media through training for both parties and also provide technical assistance to journalists in obtaining and interpreting what we call evidence. Allow me, Levi, to furthermore state to our members that we need to establish and also maintain what we call a trust and mutual relationship between journalists and researchers through what we call regular informal meetings between journalists as well as researchers. In that way, we will be organizing field visits for journalists and also build formal partnerships with professional media associates and also individual journalists. The past 6 months, I've been working very closely with community radio stations since we have discovered that young people are often listening to radio, streaming online, and the best way to actually deliver information to them that is accessible, information that is convenient, and also information that speaks to them, because the language barrier is something that we tend not to look into. Information can be there, policies can be there, but if we do not have a proper structure or rather approach of giving these young people the information they need, then it is all in vain. The mass media can contribute greatly, like I said, to efforts of addressing these challenges by focusing on public attention on these issues, making them more visible in what we call the development discourses through their agenda setting role, and also provide accurate as well as comprehensive information on these issues to the public. In so doing, the media can actually help break the culture of silence and also the high levels of stigma and discrimination associated with SRHR issues by actually promoting what we call openness as well as public discussions of these issues. It is also important as young people to actually collaborate with other organizations to create effective advocacy campaigns on a variety of sexual and reproductive health and rights issues that will actually drive us to what we want to achieve as young people in this field. We also need to identify and scale up effective strategies that will help young people to make informed, healthy choices about their sexual and reproductive lives, knowing very well that it is critical, because opening up social media, opening up the media on its own without accurate and comprehensive information will not serve us any justice. We need to make sure that the information that is put out there is information that can actually be very, very comprehensive to people that will, to the young people that will understand what it's about. Just before I close, Levi and all our members, allow me to say that journalists who produce accurate as well as timely reports about sexual and reproductive health issues can also bring taboo subjects out in the open so that they can be discussed. They can also monitor the government's progress towards achieving stated goals. But what I know for sure, if we follow these key recommendations, we can actually hold the government officials accountable to the public and also hold all the advocates in this space, in this field, accountable to all the policies as well as the implementations that have been set out to be implemented in the industry. Comprehensive and accurate media reporting on sexual and reproductive health and rights. It has not been easy, more especially when we look at the pernicious myth as well as the misconceptions due to the peer-to-peer education that young people have been giving themselves. Yet, the media's role in advancing the SRHR and particularly the bodily autonomy and the bodily integrity of African women and girls is fundamental to respecting as well as fulfilling the women's human rights. So it is crucial to create content, especially when we go to social media. It is crucial to create content that reaches men and women. It is also very much important to understand that the social context that you are posting or rather giving out on local media platforms is actually being heard. So with that being said, I would like to just say it is upon us as young people to make sure that we are the drivers of change that we want to see. It is also important that we promise ourselves successful and potential sustainable projects as well as interventions which will include the context-specific initiatives that will enable girls to stay at school and also which will delay early marriage as well as prevent unintended pregnancy. The best way to get the message across is to actually make noise on all social media platforms, but we cannot also sideline those who are unable to access digital platforms. Hence, it is also important to utilize upon all media spaces we might have, your newspapers, your local radio stations, in making sure that young people understand the important role they play in making sure that the human right is kept up to priority. Thank you so much.
Thank you very much, Ntabi Singh, for those incredibly thought-provoking insights. I think you've given us tons of food for thought, and I can already see you and Sadie forming part of leading a comm strategy, at least for this action coalition on SRHR and bodily autonomy, with your unique expertise and skill set. And I think one of the things that stand out for me is you highlighting the importance of community media, and in particular community radio, to really shape narratives and really have a feel and a pulse of what community perceptions are when it comes to issues around human rights, and in particular adolescent and youth SRHR. And definitely want to engage more with you further, and I think you should also connect with Sadie, and we should definitely do a brainstorm. Second to last panelist I want to go to now is Gertrude Mashimane, who is a friend, a comrade, and an ally at the National Department of Health. Auntie Gertie, as she's affectionately known, serves as the National Youth Programs Manager, and we're honored to have her today. Auntie Gertie, if you could indulge us. Sorry, could we please mute mics? Thank you. And Auntie Gertie, as I was saying, it's really great to have you on today's panel. And if you could indulge us, given the role that the National Department of Health plays in ensuring access to adolescent and youth-friendly services, and some of the recent thinking around the positionality of sexual reproductive and health rights in universal health coverage, as well as our very own national health insurance bill, what are some of the key department-led programs that the young people on this call, and even the ones that will listen to the recording, need to be aware of, which are purposed to improve the overall SRHR of adolescents and young people? And to get you have the floor, please.
Afternoon to all participants, and thank you, Levi, for affording me this opportunity to share the interventions that we are having as a Department of Health to try and address the challenges that are faced by young people in our country. Bottom line, young people must feel comfortable and positive in using our health facilities. You still remember back in 2016, we launched a campaign as a South African government, which is Conquer's campaign. And all department has to contribute into the campaign. And as a Department of Health, we think it is key to achieve the Conquer's objectives if young people are able to access and utilize health services. As a department in 2017, we had our National Adolescent Youth Health Policy, which has 6 objectives on it. And the first objective of the policy is that we have to use innovative youth-oriented programs and technology to promote the health and the well-being of adolescents and youth. To respond to that, as a department, we came with BWise platform, and the intended outcome of the platform was to give health-related information to young people, to make sure that young people are able to access this platform and get the clinic that is closer to them and the services that are being offered at the facility, and also to make sure that there is an opportunity to rate the services that you are having in the facility, so that we can track if we are providing the health services in a friendly way in our facilities. We have noted that we are slowly rolling out our youth-friendly services, which really is something that we need to fast track so that young people come to our facility. So we decided to integrate the monitoring of the adolescent youth-friendly services, not to be a standalone, but to be integrated on our ideal clinic. We have element 44, where we have 8 questions that are related to adolescent youth-friendly services. And in our policy, after we have noted the slow in rolling out our adolescent youth-friendly services, we have encouraged the establishment of the youth zone in all health facilities. And we saw it as a low-hanging fruit. to fast track the implementation of the adolescent youth-friendly services. The youth zone is just a dedicated time to respond to the needs of young people in our facilities. And by so doing, we are trying to transform our facilities to be seen as places where only sick people will go, because prevention is better than cure. We want people to flock to our facilities just for prevention or just to get information into health-related issues. So we also encourage that facility provide a dedicated space for young people in their facilities, even though that is not our priority. The priority is the environmental space where young people will feel more comfortable when they come to our facilities. And we also have to make sure that they will have competent staff that are in our facilities who understand young people, how to communicate with the young people, respect them, being non-judgmental. And we also trying to market that young people must be involved in designing the youth zone, the package of services that will be provided, as we want them to lead, to be drivers of change in their own life. They are the people who know the challenges. They are the ones who know the root cause. So we are encouraging them. And kindly take this message and share with other young people to say that we request them to go to our health facilities and make sure that they lead in the designing of the youth zone in their facility, because in the youth zone, we are providing the biomedical interventions, but we go beyond there where we want also the extramural activities, drama, choirs to be there, but it will be the young people who will say, based on our interests, these are the activities beyond the biomedical that we want to be implemented in our youth zone services. And they will be the one who will identify the days and the time that will be suitable for them to have the youth zone in the facilities. And we try to encourage our health providers to say that, can we start simple? Let us not be ambitious because we are going to fail and lose hope. Let's have small steps until we win big, because we will be able to bite what we can chew. And one thing that we have identified as a department is to say that instead of capacitating the health providers, there is a need to make sure that senior management at national, provincial, district do understand the concept. We get buy-in from them so that they will be able to support the implementers at our facilities. I think Ms. Pillay have indicated that we are having the integrated school health. We have the SOPs. What we need to do is to make sure that our health providers understand the SOPs so that they can implement them. Strengthen the collaboration within the sister department, Department of Basic Education, and the Department of Social Development, so that we can strengthen the integrated school health program. In Alfred Zoo in Eastern Cape, UNFPA have implemented a project in one of schools, which is Zululwazi High School. And the program that they implemented, we saw a reduction of annual 48 pregnancies to 5, which was is a proof that the module work, whereby it used the collaboration of all stakeholders that are on the field, Department of Health, Department of Basic Education, Social Development, police, and the community, where a community member offered a house that he was not using next to the school so that they can provide service there. So that is one approach that, based on the resources, we intend rolling out to other districts, high burden district, to say, can we start to work together? Not only the departments, but we go beyond to other service providers, stakeholders, pastors there, and traditional healers, and we work together and start with a committee. I think that is one of the approach that we are going to use moving forward and roll out the Zululwazi model that it is working. Yeah, in short, due to time constraint.
Thank you very much,
Thank
Auntie
you.
Gertie. I know that is usually a 25-minute presentation with at least 10 slides. So thank you so much for condensing all that information. And I can already see, again, the chat box lighting up with some questions and suggestions, especially directed at what Ketani had raised in terms of the attitudinal determinants from healthcare workers and how young people can bridge that gap in terms of social accountability and reporting. But we'll definitely come back to that. Thank you so much once again. Our last but not least panelists, Comrade Hlobisile Namandla Masinga is the founder of the Pink Roses Foundation, also an incredibly active activist and advocate within the South African National AIDS Council's youth sector space, a comrade and a friend of mine. Klobi, I want to know, what are some of the key strategies that have worked and what is lacking in mitigating the barriers to comprehensive SRHR services for young, key and vulnerable populations in your experience? And I think your intervention will really bring us to a decisive point where we can start consolidating a way forward and some rich inputs that have come out. Please go ahead, Klobi.
Thanks, Levi. Good afternoon, everyone. Wow. Like a lot has been said. I think, yeah, we just laughed about it right now on the chats as to like, do I even have anything to add at this point? But I'll just touch roughly on a few things that have already been said and specify them based on my experiences as a young person with disability and also part of the queer community here in South Africa. So basically our organization provides access to information on sexual reproductive health and rights services. One of the most key components that's been being said here on the platform today, firstly by Dr. Mofigeng, Yologazi touched on it, Gogeto also touched on it, was policies and policy making, which is, as a South African young woman, I know very well that most of our policies look great on paper, but when it comes to implementation, which has been said throughout the entire session, that on paper, they're great, but then when it comes to implementation, we still lack a lot. It's also the lack of information. Not only the fact that we do not have information, but also how it's disseminated in terms of, is everyone able to access it? And when everyone is accessing it, is it written in the right language or right manner for everyone to understand it? For example, I've never came across a pamphlet written in Braille for sexual reproductive health rights services or information about that. Very happy that right now we have 2 sign language interpreters to help us with the hearing impaired. But in our youth-friendly spaces, we don't have people like that to aid our young people with disabilities in terms of getting accurate information when it comes to sexual reproductive health or comprehensive sexuality education. In our school for young people with disabilities, comprehensive sexuality education is hardly ever spoken about. We already have a problem of not having proper comprehensive sexuality education in our mainstream schools, but in our special needs school or schools for young people with disabilities, we hardly ever hear talk of sexuality education and all of those things. I am lucky enough to know that we do have a couple of organizations, to mention Partners in Sexual Health and a few organizations within the space of Partners in Sexual Health who are now implementing the who are implementing sexuality education programs for young people with disabilities. We also have a huge problem with stigmatization and discrimination when it comes to young people with disabilities and sexual health in the country and in a lot of other countries as a whole here in Africa, with stigma and myths ranging from but you're a person with disabilities. How are you even having sex? Should you be even having sex? A lot of organizations that aren't prepared to actually start the conversation of disability and sexuality and the disabled person being a sexual person or a sexually active person. We also have the problem of funding within spaces like our organizations, like where we find that well-known and well-established organizations are the ones who are constantly being funded, whereas they don't even actually cater for the needs that are specific to SRHR for young people with disabilities. For instance, I'll make an example for myself. I run an organization that deals with these issues, but in most spaces that I go to ask for funding or like even talk to potential funders about this, the first thing people are gonna ask me is, don't you know the organization ASA? And I'm sorry that I'm putting them on the spot, but then I know that Mam Namasondo knows this and she is well aware of this, where they're like, but why aren't you doing this with ASA and stuff? Where ASA only caters for albinism as a whole, but not their mandate is not specific to sexual reproductive health or rights, or even providing sexual reproductive health and rights services. So when I get to a space where I tell people what I'm doing, people see that, oh, this is an albino face, so obviously they are associated with this organization and so forth and so on. So there's a lot that needs to be added when it comes to the SRHR mandates. I've learned a lot also being a part of this platform. Like Sadie mentioned how queer women who are HIV positive are always not mentioned in topics like this. And I was very actually shocked and like mind blown, as I'm also a queer woman and I've never even thought about such a thing, because like we grew up being told that, oh no, queer women aren't that prone to getting HIV and stuff like that. So it's also the integration of all the multiple sectors that we have in terms of providing SRHR services. For instance, I know the importance of integrating my programs with those of the traditional sector as a young person living with albinism, and albinism being such a huge topic in the traditional sector as to demystifying like everything that has to do with albinism, to stop albino killings and stuff like that. I know the importance of getting the traditional sectors into dialogues or in spaces where we talk about albinism and we try to make albinism, I won't say a less mythological topic when it comes to their spaces as well. So it's also integrating all of these SRHR objectives with all of our sectors, and also coming up with a way where I, as a queer young Black woman and living with a disability in South Africa, can't just go in one space and be like, oh yeah, you're a woman here, you're Black here. I want to be that person in all of those spaces and have every part of my personality and identity heard and feel like, oh yeah, I belonged here and all of my needs and services were addressed in this session. So until we find a way to properly integrate all aspects of our sectors, there's a long way to go. But I'm glad that we have spaces like this where we can talk about those things. And I'm glad to see that most of us actually know what to do and know what's lacking. So I'm sure that we'll actually find like proper ways to actually address all of our problems. Thanks, Levi.
Thank you very much, Comrade Hlobi, for really tying it all together for us and for really providing some stirring and thought-provoking consideration towards how we deliberately and intentionally program to ensure that we're reaching those who are often pushed the furthest behind when it comes to our programming. And I think summing up all 8 speakers, I see reoccurring themes around how we need to move from policy and paper to policy and practice, really catalyzing action. I've seen the emphasis on youth-led accountability and looking at divergent methods of accountability, be it through youth-led reporting and M&E tools, or through utilizing the media and other platforms to promote state and other actor accountability. We've seen the need for innovation and how this crisis has really accelerated innovation within the SRH space and made us do things in means and ways that we wouldn't have done 5 to 10 years ago, and really showing us what is possible if we find opportunity in crisis. I've seen the recurrent theme of integration and ensuring that there's steady, deliberate, and intentional integration between government departments, between civil society, between youth-led and youth-serving organizations, and other developmental partners more broadly, like your donors and technical agencies. I've also then highlighted the importance of the unusual suspects that Managa had spoken about, and which was reiterated by Gertie in terms of engaging religious and traditional leaders, prolific and influential figures within communities, as well as parents and other community-based duty bearers, and how that aligns to partnerships and really progressive future-facing partnerships that has the empowerment, the development, and the overall capacitation of adolescents and young people at its center. And I think I'm not going to add anything further to this, but rather throw it back to the audience now to really air some of their views, to read through some of the comments and take some of the questions. Unfortunately, due to time constraints, I'll only be able to take 4 questions with the mic. And I will look at taking 4 that have come out within the chat box. And this is unfortunately due to time constraints, but you have my word that we as an action coalition will definitely follow up on this initial dialogue. This is the first of many, as you have heard from Sis Anne at the start. This is a process that is just commencing now, that is going to run all the way till 2026. And we're really trying to build this coalition and this action coalition for the action that we've been discussing. So if you would like to take the floor, please do raise your hand and I will recognize you and I will ask the tech team to unmute you so that you can make your intervention. I'm looking for hands now. I'm not seeing any hands as it is. Whilst I wait for hands, I will maybe head to the Q&A section to read out some of the questions that have been populated there. We have a very interesting question from Nokuzola Ndwandwe in asking how can we make use of this information in our menstrual health workshops. I would really love to distribute this information, especially in rural communities. I will ask some of the colleagues to consider a response to that. Maybe Koketso and Yolakazi, you'd want to handle that one. There's also a similar question from Nokuzolo on how would you recommend we train young people to become advocates of SRHR in their own communities. Hlobi, if you want to chime in there. Brian's question was responded to by Managa. Another question by Nokuzulo around SRHR information online. Again, colleagues, whoever feels comfortable to take that, please do factor in your responses. But before that, Jimmy, I see your hand is up. I give you the floor. Please introduce yourself, tell us where you're coming from, and please pose your question to the specific panelist. Thank you.
Okay, thank you very much, my leaders. I'm Jimmy Mtombeni. I'm an activist from Pretoria. My concern or the question is, by the way, let me start here because I was I was an activist from. I was introduced by Love Life as we were going to schools, teaching young people about sexual activity, all those things that have to do with sex life and the overall well-being of a person. So my that how cannot or why can't government and
Sorry to do this, Jimmy.
potential powerful sectors, activists and other organizations and other private sectors who are on the ground and talk to them, give them a mandate on.
Sorry, Jimmy, you're completely unaudible. Your connection seems to be breaking at the most important parts of your intervention, and I have to move on to another speaker. If you don't mind populating your question into the chat box, I don't mind reading it out and definitely getting an answer for you. We don't want to lose your contribution, but at the same time, we do need to keep the program moving along. So could you please populate your question into the chat box, and I will read it live and solicit a response from the panel. Deep appreciation, Jimmy, and I'm so sorry about your poor connection. Anyone else would like to take the floor and have your mic unmuted? I don't see any hands, so I'm going to ask Yolokazi and Comrade Koketso to share the question on menstrual health workshops, as well as recommendations on training young people to become advocates for SRHR in their own communities. And Tabi saying you can also chime in there. I know that the Srhr Youth Network also does some phenomenal work around capacity building and strengthening. So please also feel free to chime in there. So let's go to Tabi saying, we go to Koketso, and then we'll go to our other colleague. Sorry, my computer's acting up.
Thanks, Levi. Should I go ahead?
Yes, please do. Please do.
Okay, thank you. Firstly, let me tackle the question from Nokzola and Wandwe on how we would recommend that we train young people to become advocates. So firstly, the term advocates is not necessarily put aside for a selected few. For anyone who's advocating for a particular cause, then they can call themselves advocates. So what I do in my own community, you talk to young people. So I usually, like in my village, I would talk to young people about issues that affect them in their own, we use this course, their own language, in terms of when you go to the clinic and then the nurses do not maybe give you proper services, what do you then do? Do you ask them for better services? So if then they refuse, where do you report? Then they know where to report. So that's the basic training. Then when resources and facilities are there, then you can take them to a proper place when they get trained on policies. These are the policies that we have. This is how you can interpret the policies. This is how you can actually hold people accountable. If things are not done the way you want them to be done, then that's a training. So it doesn't have to be done by the government. It doesn't have to be done by a particular organization. But if you are one person who has knowledge on a particular subject, like now, I know a much more on SRHR, GBV, and also I take my academic space into my community and try to engage young people, then they also can become advocates. And one thing that I did earlier this year and sometime last year, when I was assisting young people to apply for university in my other space, I would also engage them on SRHR, because one thing that I would speak to them about is that when you go to institutes of higher learning, this is what you can expect. Please, in order for you to prevent a number of things from happening, why don't you go to the clinic to make sure that you are setting yourself with the services that the Investi Clinics has? Secondly, you go to another placement in the institution to also see what services you can utilize to ensure that your stay in the institution is much more impactful and is changing your life. Then they become advocates. Right now, we you share the same spaces. So that's how trainings can go in various communities. But to take it a step further, we can definitely liaise with the departments. I know the Department of Health in the regions, they do train young people, and also they do invite civil societies to their meetings. For instance, in the Eastern Cape, we get to participate in the provincial forum with Department of Social Development and the Department of Health. We sit in one meetings and discuss these issues so that you can propose in that meeting. Then also the question on how we can make use of this information in the menstrual health workshops. Definitely this information belongs in that workshop. So it is very much, I would say very much impossible to discuss menstrual health without discussing comprehensive sexuality education and also discussing the SRH at large. So this information, it has to be part of one package. When you go and discuss issues that relates to bodily autonomy and issues relating to sexuality and reproductive health and rights, this information is one package. So that's what I would suggest for now. But for more information, please do get hold of us. We are definitely there to assist where needs be.
Thank you very much, Comrade Yolo. Very much appreciated. I see Koketso endorses your sentiments and has nothing to add. And Tabi Singh, do you have anything to add with regards to the capacitation question or the MH1?
I would like to just quickly respond to Nokuzula. Yes, Nokuzula Ndwadwe, but obviously I'll need to respect time on that. One thing we always advocate for, Levi, and of course my fellow colleagues, is that we need to be inclusive in everything that we do. And we also need to make sure that our approach is holistic. With that being said, I'm referring to a situation where we cannot only pose changes or rather comprehensive implementation on only one group or one certain gender, because we need to understand at all times that sexual health as well as reproductive rights, they see no color, they see no gender, they see no race. We are all affected, or also we're all affected in one way or the other. And also just to respond furthermore, I'm not going to take time. Nokuzula, it's also in terms of opening up conversations that are able to speak to the people that are affected. We need to make sure that we create safe spaces, because one of the reasons why we have taboo subjects that are not touched on, it's because people are in fear of being judged. But as advocates, we need to open up spaces that are accessible, spaces that are convenient, as well as spaces that are actually safe for young people to actually communicate. In that way, we are able to eliminate what we call the legal as well as the economic social barriers that results in the unequal access to information. And we are also able to enforce zero tolerance for all forms of coercion, violence, as well as discrimination. So opening up spaces that are free, spaces that are safe, spaces that are actually accessible is actually one way where we are able to bring in all groups of different abled people to be able to participate in this fight that we are fighting as advocates.
Thank you very much, and Tabi Singh, that's very useful, and I think that responds very well to the comment posed. Jimmy, thank you so much for your question. I can see it now. Jimmy asks, why can't government and other potential bodies get activists and organizations that have successfully worked with young people in school and out of school, get them to do work as they used to do? Because I know that there is a database on that. So maybe a question to the government colleagues, Auntie Gertie or Managa, could I pose this one to you, or either of you? I know, Auntie Gertie, for instance, there is already some existing collaboration, for instance, through the youth zones with Soul City and the Groundbreakers and the activators within that program itself. Maybe you'd like to speak to that, and hopefully that does respond to what Jimmy is asking. Katania, I see your hand. Please go ahead.
Yeah, I just wanted to fill in while Katie is logging in. Jimmy, what we have noticed, I think that's a very good question, and the observation you are making is correct. It seems as if government is no longer fully supporting the civil society organizations that were, if you'd like, at a ground level. However, what we have noticed the trend had been recently is we've seen very, what would be the word, low available donor funding. And in the past, where we would be able to rope in donor funding, that has really dried up, and less organizations are being assisted. And with government, then we then find ourselves having to split the little resources that we have across all the other sectors. So yeah, so I think right now it's a matter of prioritization of SRHR, having sure that it is high up on the agenda. We see, for example, the uses of making sure that these programs are at a ground level, and the more we can do that, then we are able to redraw the donor funding that we have been losing. Thanks, Levi.
Thank you very much, Kentani. Very useful. Managa, I see your hand. Please go ahead. I'm already spurred around the work that DOB is doing with MIET on the CSTL.
Yeah.
That sounds, yep.
Yeah, no, just, you know, in terms of the Global Fund mechanism, obviously the modality is very organized in terms of distribution of resources to principal recipients, who then in turn work within, you know, community spaces to look at what we see as civil society organizations. So I think from a department perspective, it's moderated in that way. You know, so obviously we work with what we call, or what the Global Fund calls sub-recipients, you know, but in terms of a direct relationship with the department, you know, we don't facilitate any direct relationships given the funding modality. So that's where things stand at the moment with us as well.
Thank you very much, Managa. That is also a very succinct explanation about where we are. I've just seen a response from Auntie Getty from the DOH, and she's had to leave due to a training that she is closing. But she says that DOH is still funding Love Life to disseminate health information and outreach activities in communities, and she'll be able to share a database of some of the community-based organizations that are actively working in the respective provinces where the youth zones and BYs is being implemented. So if anyone is interested, we will share that database along with the relevant resources from this meeting. I have to unfortunately bring this meeting to a culmination and some sort of close. As many of you may notice, we've gone significantly over time, and I know that the panel in particular must be exhausted, as well as the presenters from early on, and I thank them for staying on and following the discussion. But one interesting question from Gilbert in the chat. Gilbert is from Zambia, and we've also seen some participants from Malawi indicating the regional nature of this conversation and the regional nature of interest that has been solicited. Gilbert's asking, how do we connect organizations in Zambia to network with some of the organizations that are on this call? And I think this is definitely food for thought. I know, Kentani, through your work at DST and through our own Nairobi Summit commitments, we've committed to South-South and triangular cooperation. So definitely food for thought for a further discussion on how we get CSOs and in particular youth-led and youth-serving organizations to consolidate efforts and really network and share best practices and share tactics and strategies under the auspices of the Nairobi Summit commitments and what's been facilitated at that platform. But that being said, I would now like to close off this segment and hand over to an esteemed colleague and absolute SRHR champion in the form of Mr. Zain Dangwar, who is the Special Advisor to the Minister of International Relations and Cooperation. Zain has been an incredible resource in most of the international negotiation spaces, in particular CSW and CPD, and is a force for good when it comes to advancing our value-based foreign policy, especially when it comes to population development issues. Zain, if you would not mind to unmute yourself and come on the big screen and render closing remarks. Thank you.
Okay, thank you, Levi. I can't show my face because the camera has been blocked on your side, but on behalf of the sort of government partner in the forum and the convening partners, I'd like to thank you for bringing together a very powerful panel. I mean, you've got Dr. TU, you've got, you had Anne Kitugu, who's also been active in this space for a very long time. And of course, the wonderful panel that presented and also engaged with the question and answer issues. I missed some of the discussions, as I indicated earlier. I needed to step out and deal with a press conference around the initiatives in New York around vaccine equity and the work that South Africa is doing around a waiver in Geneva. And it took way longer than I expected, so my apologies for that. But I just want to, in closing, make a couple of comments. I won't take too much time. Is earlier on and Dr. T and pointed out that this is something that we need to reframe. There's a moral crisis about unwanted pregnancies amongst young people, including adolescents and school-going young women. That moral crisis should be framed differently. We should be having a moral crisis about the fact that there is unwanted sex. There's rape. There was no access to sexual and reproductive health rights services during the pandemic. There was no comprehensive sexuality education to help protect young women in our homes, in our communities, from the kind of predatory behavior that often gives rise to these kinds of unwanted pregnancies and the spikes therein. And it's something we spoke about maybe 10 years ago when there was a similar spike. And we need to change this as young people. Young people also need to lead the way with us in changing this narrative. So we don't focus on shaming young women for falling pregnant and this notion of teenage pregnancy. Whereas in fact, the major issues underpinning that is there was unwanted sex, undoubtedly. There was a failure in the system in terms of providing services. And there was a failure in the service in the overall protection that's provided. I want to move on. That leads me to my second point is that, until there's a building of consciousness around the fact that people own their own bodies, including young women, and around the issues of bodily autonomy and integrity that we find in our Bill of Rights and including in the Section 12 of the Constitution very, very forcefully, then the kinds of issues that we seek to address won't be dealt with effectively. We really need to ensure that part of our inclusive discourses and participation and the role of young people is to help shape the consciousness, not only in South Africa, but the region, about equality, bodily autonomy and integrity. And that's another way of saying that the ideologies of superiority that we need to break down are many. And we include ideology of white supremacy, which is racism, ideology of male supremacy, which is patriarchy. There's ideology of what I call heteronormativity that also sort of others the LGBTI community. So these are the kinds of issues that when we engage with them, we need to be open and honest, and there should be no taboos. The discussions around comprehensive sexuality education, and we've seen the fight back ever since we've had agreement on implementing this. We've seen the fight back, and the fight back coming from many quarters, including well-funded civil society organizations from the US, working with counterparts in Africa to ensure that they put a moral tag on this. But what they're not also telling us is that these discriminatory practices, the laws and policies that we have, that other women's bodies are primarily laws and policies that we inherited from our colonial era. So progressive laws and policies that protects us, that protects young women, young adolescents, protects the LGBTI community, are essentially part of this decolonization project that we should be really pushing forward. And so CSE should not be a taboo subject. We should be talking about what kinds of new cultures we want to build that is different to the one that has been shaped from a colonial history that was steeped in racism as well. And it brings me to some of the stuff Dr. T spoke about, intersectionality. And she spoke also about the intersectionality of human rights in her role in her reports as a special rapporteur, and the issue of inclusive rights. And this takes me into the global stage. Intersectionality can be seen through many lenses. And one of those lenses is which human rights our partners push, right? So we will have our partners with us in forums like this, talking about issues that we agree about, like Srhr. But in Geneva, they are blocking access to the right to health, which includes the right to medicine for African women, for young women, and for adolescents, giving rise to about 10,000 deaths a day from having no access to life-saving medication. So that intersectionality and on the type of human rights that we push and the consistency is so important. So that is one thing that, and as a challenge to some of our partners from the European Union and the European Commission, that the kinds of issues, the kinds of human rights language and discourse is gonna be undermined when there's no consistency on the kinds of human rights that are being championed, because they are intersectional in nature. The right to health, as Dr. T pointed out to us, is an inclusive right. You can't segment it in ways that we often see. Thanks. I see I just saw your message about the camera. So I think that is my camera is being put on as I close up. So we need to hear the human rights voices, not only of civil society, it's important, and we welcome the human rights voices of civil society, but we need the governments from some of our partner countries to step up to ensure that they are consistent in the manner in which they champion human rights in the global platform, what they fund at national levels, and what they're willing to support in global forums. Thank you, Levi, and thank you again to really a wonderful panel and wonderful discussions.
Thank you very much, Mr. Dango, for those incredibly useful closing remarks and for that thought provocation that really does segue quite nicely through all the comments and interventions that we've got from all the panelists, but especially tying to the broader macro drivers of poor health and poor SRHR for adolescents and young people, especially those determinants around the right to health. Incredibly thought-provoking, and we really thank you for freeing up your schedule to really attend and participate actively. And we're rest assured that many of the recommendations that have come out in the vein of Nairobi, of the Generation Equality Forum, of the SADC SRHR strategy would be cascaded and directed towards the minister, as well as some of the other colleagues that do engage in the multilateral negotiating spaces. Deep appreciation. And with that, I have the privilege and pleasure of closing off this stellar panel. To all those who stayed on over half an hour onto the previously scheduled time, thank you so much. We would really like to keep in contact with all of you as we move towards growing this coalition and really ensuring that it reaches more people and is more representative and more inclusive. So please drop your contact details into the chat box or engage with us on email. If you have registered, you will receive the recording as well as all the relevant materials for the session. And we will definitely be sending out some sign-up sheet of sorts in which you can input your details and indicate your interest in forming part of this action coalition on SRHR and bodily autonomy. I'd like to thank once more Dr. T for staying on right to the end. Thank you to Sarah, thank you to Katani, thank you to Sadie, thank you to Gertie, thank you to Koketso, thank you to Flobi, Managa, Yolokozi, Tabi Singh, everyone who's really part of this panel and have contributed immensely. Thank you to the fellow Action Coalition members and all the support that we've gotten from everyone, including our government colleagues who are also represented within the Action Coalition. And profound thanks to UN Women for hosting us on this platform and for ensuring that everything runs smoothly. To Sawad, to the interpreters, deep appreciation for making today a success, and looking forward to some accelerated action on this agenda over the next 64 months. With that, I have the pleasure of closing. Thank you all for your time, your attention, your active participation, and looking forward to connecting with you all as we move ahead over the next 64 months. Take care, everyone. Goodbye.
Excellent work, Levi. Thank you.
Thank you very much, Marta. Thank you to
You
all the
were
Sawad colleagues.
excellent. Thank you so much. Congratulations to everyone, really. Well done. And thanks for the moderation. It was seamless. It was very good.
We're humbled. Thank you very much. Take care, everyone. Have a good day further.
Thank you. Bye-bye. Bye, everyone.